By age 60, half of men have an enlarged prostate. And when you reach the age of 85, that proportion jumps up to 90%. But thankfully, there's a leading edge treatment right here in Central Ohio that can help with this growing problem. So today, we're here with Dr. Jack Ogilvie from Central Ohio Urology Group. It's very nice to meet you.
Very nice to meet you as well.
So what type of treatment do you specialize in and do here?
Yeah, so I'm an interventional radiologist. I actually work for the urology group here, but we focus largely on a procedure called a prostate artery embolization. It is a procedure that's minimally invasive to treat benign prostate hyperplasia. So this common issue that a lot of men get as they get older, where the prostate gets bigger and they start to have urinary symptoms like frequency, urgency, these types of things. We want to go in and do this minimally invasive procedure to actually shrink the prostate down. So the way prostate artery embolization works is it's really an alternative to some of the other procedures that traditionally have been done for benign prostate enlargement. And again, the key here is that it's minimally invasive. Traditionally, when we've treated prostate enlargement, the urologists go through what's called a transurethral approach, meaning that they have to actually work up through the urethra. They're working on the inside of the prostate. My approach is totally different for this prostate embolization. Really, I'm just going through a needle puncture in the right groin. It's very similar to a heart catheterization or something like that. And from there, I'm doing a fancy version of plumbing where I just work through the inside of the arteries. I map the arteries out. I'm using a little wire and tube to select different arteries. And my goal is to find the arteries that go to the prostate and actually block those off to shrink the prostate down.
That's fascinating.
Yeah.
So Jack, what do the risks look like with this procedure compared to other procedures and even long-term medication?
Sure. So one of the big benefits of this minimally invasive approach that we do is that the risks are so low. You know, we always talk about very small risk of bleeding, infection, things like that that are inherent to any kind of procedure, but really I'm just working through that small needle puncture. So those risks are exceptionally low. And then from there, I always make sure I'm really confident that I'm in the correct arteries before I start blocking anything off. So it's very unlikely that I would block off an incorrect artery or something like that. We can be very precise with how we're blocking these arteries off to make sure that we're just targeting the prostate. So yeah, with the transurethral procedures or the kind of typical surgeries that are done for prostate enlargement, post-procedure recovery is a lot more involved than what we're doing. Other risks that they always talk about with the transurethral procedures, sexual dysfunction is something that commonly comes up, and that's really something that the risk is extremely low with a prostate embolization, which is one of the big advantages. Really, the recovery from a prostate embolization is quite a bit less than one of these other surgeries that's done for the prostate. This procedure is all same day, it's outpatient.
Wow.
You know, patients are in the office for a total of about 4 hours or so, and then they're going home and they're walking as soon as they get home and everything like that. So it really is quite a bit better.
And finally, Jack, why have it done here?
Yes, so Central Ohio Urology Group has entered into a partnership with IR Centers. You know, I am an employee of the urology group here, but I'm part of a bigger network of IR physicians that specialize in these procedures around the country. So we have a knowledge base that's second to none really in the United States as far as doing this procedure goes. And we do more of these procedures here than any other entity in the United States really. So because this is our main approach, this is the most common thing that I do here. I've done over 600 of these procedures here in my time just here. So really the experience is just bar none. And really that integration with the urology group is kind of what you want for this type of procedure as well. I'm talking directly with the urologist. Obviously, they're doing the workup and sending me patients that are a candidate for this, and we're going back and forth through the follow-up as well. So it's all very integrated, and that's kind of what you want with this.
Jack, this has been incredible and honestly inspiring to see the latest technology and know how many people you're going to be able to help with this.
Yeah, absolutely.
Thank you so much.
Very nice meeting you today. Thank you.
Like he said, if you want to find out more information, first speak to your personal doctor, but you can also go to centralohiourology.com.